Hello, I am Dr. Chandana Reddy from Krithi Skin Clinic, Karimnagar. Today we are going to discuss about the most common and important thing, that is hair. So what is hair? Hair is a protein called keratin that grows from the follicles that are present throughout the body. But కొన్ని areas lo we call it as terminal hair, like scalp hair, ivanni terminal hair. They grow thicker and longer. But almost all of our body is covered with hair. కొన్ని hairs are very fine hairs, we call them as villus hair. Let us know about few facts of hair. Hair అనేది how it grows అంటే hair will grow in a few cycles. Like కొంచెం amount of hair on our body is present in a phase called anagen phase. Some amount of hair is present in catagen and telogen phase. But mostly the dominant amount of hair is present in anagen phase. Anagen phase is a growing phase. 80% of our hair is present in a phase called anagen phase. So 20% is present in telogen phase. So every time when we comb our hair, some amount of hair loss will be there. The hair that is shedding down is a telogen hair, that is very common for everybody. And now when we consider it as a hair loss, if more than 100 hair are lost per day, then it is called as hair loss. Antakana takku hair poina, there is no need to worry. Only considerable amount of hair loss is more than 100 hair per day. Hair loss is considered as hair loss. Few general facts, like how many hair are present in our body. Around 1 to 1.5 lakhs of hair strands are present on our scalp. And for normal people, hair will grow around half an inch per month. But for few people, hair growth చాలా ఎక్కువ ఉంటుంది. లైక్ టిలోజన్ అనజన్ వెరీ యాక్టివ్ ఉన్న వాళ్ళలో hair growth చాలా faster ఉంటుంది. అండ్ ఫ్యూ పీపుల్ విల్ హ్యావ్ వెరీ లాంగ్ హెయిర్, ఫ్యూ పీపుల్ విల్ హ్యావ్ షార్ట్ హెయిర్. ఎన్ని ఇయర్స్ కట్ చేయకుండా ఉన్నా కూడా వాళ్ళ హెయిర్ అంతే ఉంటుంది. దట్ ఈస్ బికాస్ ఆఫ్ ద ఫేజ్ ఆఫ్ అనజన్. అనజన్ ఫేజ్ చాలా లాంగ్ ఉంటుంది, కొంతమందికి 4 to 5 years. అనజన్ ఫేజ్ ఎంత లాంగ్ ఉంటే హెయిర్ గ్రోత్ అంత లాంగ్ వస్తుంది. అండ్ దిస్ హెయిర్ అనేది వెన్ ఇట్ మూవ్స్ ఇన్ సైకిల్స్ 4 to 5 years అనజన్ ఫేజ్ మెయింటైన్ అవుతుంది. సో కొంతమందికి ఆ 4 to 5 years తర్వాత ఒకసారి ఎక్సెసివ్ హెయిర్ లాస్ అవుతుంది వెన్ అనజన్ hair shifts to the telogen phase. Now coming to the topic of hair loss. As I told you, more than 100 hair loss per day is considered as hair loss. Antakana takku pothe we need not worry. Some amount of shedding is very common in a day-to-day life. So what are the causes? Most important cause is nutrition. Poor nutrition is the most important cause, and the next thing comes is stress induced, and the other thing is hormonal induced. Then remaining other things like chemotherapy can cause any surgery, trauma. All these things are very minor things, but the most common thing for every Indian female is nutrition. Again, in the nutrition, what are the important nutrients for hair? That is, iron is most important. Apart from iron, B12, biotin, vitamin D, and proteins. As I told you before, hair is a protein made up of keratin. So for hair to grow, we need lot of protein intake. And the second thing is stress induced. Stress is very common for everybody and it is inevitable. Stress can cause lot of hair fall, especially when there is a sudden amount of stress, like some disturbance in the family or some health issues, hospitalizations, like these kind of stress. It can cause hair loss at the end of 3rd month after the stressful event. So whenever a patient comes to us and complains about sudden amount of hair loss, then we ask them about any stressful event 2 to 3 months prior to the onset of hair loss. And the other thing is hormonal issues, like for females it can be PCOD, or even thyroid can cause, any other endocrine issues can cause hair loss. These are the most common causes. Symptoms of hair loss. Hair loss lo, generally we see lot of amount of hair shedding. This is a normal type of hair loss, like nutritional hair loss lo gaani, protein deficiencies lo gaani, stress induced lo gaani, we see lot of hair shedding. But in few cases like hormonal hair loss, PCOD, atlanti conditions lo emotundante we need not see the amount of hair loss. Suddenly there will be thinning of the scalp. పార్టిషన్ అనేది అయితే మధ్యలో తీస్తామో పార్టిషన్ అనేది సడన్గా వైడ్ అవ్వడం, స్కాల్ప్ విజిబుల్ అవ్వడం, హెయిర్ లాస్ ఎక్కువగా ఉండదు కానీ హెయిర్ అంతా థిన్ అయిపోవడం, స్మాల్ స్ట్రాండ్స్ లాగా అయిపోవడం హెయిర్. దీస్ థింగ్స్ వీ సీన్ యూజువలీ హార్మోనల్ హెయిర్ లాస్. Hormonal hair loss in females common causes PCOD and thyroid. బట్ ఇన్ మేల్స్ అగైన్ ఆండ్రోజెనిక్ అలోపేషియా అంటాం అనమాట. లైక్ మేల్ ప్యాటర్న్ బాల్డ్నెస్, ఫీమేల్ ప్యాటర్న్ baldness and male pattern baldness both are like mostly hormonal induced. Female pattern baldness is because of PCOD and thyroid. Male pattern baldness is because of mostly genetics, because of the high active end organs. End organ receptors are more active to testosterone levels or dihydrotestosterone levels, so that will cause male pattern hair loss. Male pattern hair loss lo we grade it as grade 1 to 8, that is Norwood Hamilton grading. Female hair loss lo we grade from grade 1 to 4, that is Ludwig scale. Information about the prevention and treatment of hair loss, you can watch it in our video part 2. Thank you.